Welcome back to another episode of Treat the Cause, Not the Symptom with Dr. Carey Girgis.
Many people ask me the difference between traction and decompression. Well, there is a big difference. Decompression now is a buzzword. A lot of people use it because obviously they heard that it works. So therefore, a lot of people offer traction and call it decompression. Or they use the term kind of loosely. But the difference, traction is a linear force. When we put a patient into traction position, the machine is set at a certain force and it pulls and it stays at that level. The natural response of the body, it guards, the muscle tighten up. As soon as you pull, it guards. So if you have a bulging disc, that's not a good thing, because once the muscle tightens up, it squeezes the disc, causes increase in pressure inside the disc, causes the bulge to become worse. So when is traction is good? Traction is good when you have muscle spasm and you go out, play sports, and you hurt yourself and your muscles are tight, but you don't have a bulging disc or herniated disc. So we put you on the traction machine. The traction machine works the muscle tightens up. It doesn't matter really, because the machine is going to work it out until it fatigues and relaxes and you feel better. So what is decompression then different? The difference in decompression is logarithmic. It's not a linear force. It moves with on a curve, a little by little by little by little by little. And it also is set up, the equipment, it's a specialized equipment that has a tensiometer that senses the muscle activity. If a patient tightens up for whatever reason, the tensiometer backs off and the treatment is reduced and causes the muscle to relax, and then it pulls back out. So by doing so, it eliminates the guarding of the muscles. And when you eliminate the guarding of the muscles, we are able to then open up the vertebrae apart, separate them enough to create a vacuum pressure inside the disc itself. And that vacuum becomes like a suction, and it begins to pull the nutrients and oxygen and fluid back into the disc and rehydrates it and takes the pressure off the nerve, and the person begins to feel better. So it's really, the equipment is very important to have that to use, and the experience of the doctor and the knowledge and the certification that they have to do that is not relying on a salesman just to try to sell them a machine. And so that's what we focus on, the cause, and try to take the pressure off the nerve, eliminate the need for surgery or serious injections.
Thank you so much for watching another episode. If you're enjoying this content, please consider subscribing. And if you have any questions for Dr. Girgis, please leave them down in the comments below. And of course, if you'd like to make an appointment, head on over to backpainreliefohio.com.